Welcome to Med Studious. In this video, we are constructing the complete clinical blueprint of the trunk, the macro to micro spatial atlas of the thorax and abdomen that forms the foundation of all diagnostic localization in clinical medicine. The trunk is the central pillar of the human body. It houses the most vital organs in existence: the heart, the lungs, the liver, the stomach, the kidneys, the intestines. When a patient presents with chest pain, abdominal discomfort, or an abnormal finding on imaging, the very first thing a clinician does is locate the symptom or finding within a precise regional framework. Without that framework, diagnosis becomes guesswork. With it, diagnosis becomes systematic, repeatable, and communicable across any clinical team in any country in the world. This video will take you from the broad topographical zones of the chest and belly through the precise 9-region abdominal grid all the way down to an organ-by-organ locator matrix that tells you exactly where every major abdominal organ sits. This is the trunk blueprint. Let's build it.
Before we map individual regions, we must establish the trunk's most important anatomical boundary, the diaphragm divide. The trunk is divided into two major territories by the muscular diaphragm, the dome-shaped respiratory muscle that separates the thoracic cavity above from the abdominal cavity below. The superior territory is the thorax, the chest, bounded superiorly by the thoracic inlet at the base of the neck and inferiorly by the diaphragm itself. The thorax contains the heart within the mediastinum, the two lungs within their pleural cavities, the trachea, the esophagus, and the great vessels. The inferior territory is the abdomen, also called the midriff, bounded superiorly by the diaphragm and inferiorly by the pelvic inlet. The abdomen contains the majority of the digestive organs, both kidneys, the adrenal glands, and the major abdominal vessels. Why do we divide the trunk into regions? To establish a shared coordinate system that enables precise, unmistakable communication regarding the location of anatomical structures, injuries, and clinical pathologies. The diaphragm is that system's equator.
We begin our trunk atlas in the thorax, and the anterior chest wall is divided into 5 distinct named regions that together cover the entire superior trunk, from the clavicles down to the costal margin. Region 1 is the infraclavicular region, the zone immediately below each clavicle, located between the deltoid muscle laterally and the sternum medially. Region 2 is the sternal region, subdivided into the upper sternal and lower sternal zones running along the midline over the sternum, from the manubrium down to the xiphoid process. Region 3 is the mammary region, also called the pectoral region, covering the breast-bearing area of the anterior chest wall. Region 4 is the inframammary region, the zone immediately below the breast, overlying the lower ribs and costal cartilages. Region 5 is the lateral pectoral region, framing the outer edges of the anterior chest wall and extending around the thorax toward the axillary region. These 5 thoracic regions provide the surface map for localizing all chest wall findings, from rib fractures and costochondritis to breast pathology, cardiac auscultation points, and subcutaneous emphysema.
Let's zoom in on the two most medially important thoracic regions, the infraclavicular region and the sternal region, and define their precise anatomical boundaries. The infraclavicular region is bounded superiorly at the north by the clavicle itself. Its inferior boundary, the south, is the second rib. Its medial boundary, the compass east and west, is the manubrium of the sternum. Critically, this region contains the apices of both lungs, the superior tips of the lungs that extend above the first rib into the base of the neck. This is why an apical lung tumor, known as a Pancoast tumor, can cause Horner syndrome and brachial plexus symptoms, because the apex of the lung sits right here in the infraclavicular zone, adjacent to the lower cervical nerve roots and sympathetic chain. The sternal region runs the full midline length of the sternum and is flanked bilaterally by the mammary and inframammary regions. It is subdivided into the upper sternal zone, overlying the manubrium, and the lower sternal zone, overlying the sternal body. The lower sternal zone is clinically crucial because it overlies a large portion of the heart, making it the site of cardiac auscultation and the compression point during CPR.
We now map the three lateral and inferior thoracic regions, the mammary, inframammary, and lateral pectoral zones, each with precise rib-based boundaries. The mammary or pectoral region spans from the third rib superiorly to the sixth rib inferiorly, with its medial boundary running from the lower sternum to the xiphosternal joint. It contains the breast tissue and the pectoralis major muscle on each side. On the left side only, it also contains part of the heart, specifically the left ventricle, which projects leftward beneath the breast. This is the region where the cardiac apex beat is palpated in the left fifth intercostal space in the mid-clavicular line. The inframammary region lies below the mammary zone, beginning at the sixth rib superiorly and bordered inferiorly and medially by the 6th through 10th costal cartilages. On the left side only, it contains the apex of the heart, the very tip of the left ventricle, which is why the point of maximum impulse is located in this region. The lateral pectoral region frames the outer thorax, bounded medially by the inframammary region, laterally by the axillary region, and inferiorly by the abdominal hypochondriac region. It extends dorsally around the thoracic cage.
We now cross the diaphragm into the abdomen, and immediately we encounter one of the most debated questions in clinical anatomy. Should you use the 4-quadrant system or the 9-region system? Both systems divide the same abdominal surface, but they differ dramatically in precision and clinical application. The 4-region scheme uses just 2 planes, one vertical midline running from the xiphoid to the pubic symphysis, and one horizontal line at the level of the umbilicus. This creates 4 quadrants: right upper, right lower, and left lower. This system is fast, intuitive, and universally used for rapid bedside assessment, such as noting that a patient has pain in the RLQ, immediately suggesting appendicitis. The 9-region scheme uses 4 planes, 2 horizontal and 2 vertical, creating a 3x3 grid of 9 named zones. This system offers superior specificity. It is essential for isolating specific organs, localizing clinical symptoms with precision, interpreting radiology reports, and arriving at a refined anatomical diagnosis. The 2 systems are complementary, not competing. Learn both. Use the 4-quadrant system for speed. Use the 9-region system for precision. Together, they give you complete clinical flexibility.
Now, let's build the 9-region abdominal grid from scratch, because understanding how the planes are constructed anchors all the region names permanently in your memory. The grid is created by 4 anatomical planes, 2 vertical and 2 horizontal. The 2 vertical lasers are the left and right mid-clavicular lines. Each drops straight down from the midpoint of its respective clavicle to the midpoint of the inguinal ligament. These lines divide the abdomen into a left column, a central column, and a right column. The first horizontal laser is the subcostal plane, the upper horizontal line. It runs laterally at the exact level of the lower edge of the 10th costal cartilage. This plane separates the upper row of regions from the middle row. The second horizontal laser is the transtubicular plane, the lower horizontal line. It passes directly through the tubercles of the iliac crest bilaterally and through the body of the 5th lumbar vertebra, L5. This plane separates the middle row from the lower row. Where these 4 planes intersect, they generate the 9 named regions of the abdomen, 3 rows of 3. The subcostal plane above, the transtubicular plane below, and the 2 midclavicular lines on either side.
Here it is, the complete 3x3 master abdomen dashboard, all 9 regions displayed in their proper positions. The upper row contains 3 regions, from left to right: the right hypochondriac region on the right, the central epigastric region in the middle, and the left hypochondriac region on the left. The middle row contains the right lumbar region, the central umbilical region surrounding the belly button, and the left lumbar region. The lower row contains the right inguinal region, the central hypogastric region, and the left inguinal region. A critical terminology note: the hypogastric region literally means below the stomach, from the Greek hypo, meaning below, and gaster, meaning stomach. It is also commonly called the suprapubic region or the pelvic region, all referring to the same central inferior zone. The 9-region dashboard gives every abdominal organ a precise address. Pain in the epigastric region points to the stomach, pancreas, or heart. Pain in the right hypochondriac region suggests the liver or gallbladder. Pain in the right lower quadrant, the right inguinal region, is the classic location for appendicitis. 9 zones, infinite clinical utility.
The superior tier of the 9-region grid contains the 3 most organ-rich zones in the abdomen. Let's inventory them one by one. The right hypochondriac region houses the right lobe of the liver, the largest solid organ in the body. It also contains the gallbladder, the first part of the duodenum, the hepatic flexure of the colon, and the upper half of the right kidney. Right hypochondriac pain is the hallmark of cholecystitis, hepatomegaly, and right-sided kidney stones. The central epigastric region is the most densely populated zone in the entire abdominal grid. It contains the abdominal esophagus, the pyloric part of the stomach, the entire spleen, the bulk of the pancreas, the horizontal part of the duodenum, the liver, both suprarenal glands, parts of both kidneys, the ureters, and the transverse colon. Epigastric pain is one of the most clinically challenging presentations, precisely because so many organs converge here. It could represent gastric ulcers, pancreatitis, aortic aneurysm, or even a myocardial infarction radiating downward. The left hypochondriac region contains a portion of the stomach, the left kidney, the spleen, the tail of the pancreas, the left lobe of the liver, small intestines, and the transverse and descending colon.
The middle tier of the abdominal grid, bounded by the subcostal plane above and the transtubercular plane below, contains another rich collection of organs distributed across the right lumbar, central umbilical, and left lumbar regions. The right lumbar region houses the tip of the right lobe of the liver, the gallbladder, the ascending colon, the lower part of the right kidney, and the duodenum. Right lumbar pain can indicate ascending colon pathology, right-sided urolithiasis, or referred hepatic pain. The central umbilical region is named for the umbilicus, the belly button, which sits at its approximate center. It contains the stomach, the pancreas, the lower part of the duodenum, the jejunum and ileum of the small intestine, the cisterna chyli, the lymphatic collecting cistern at the root of the thoracic duct, the transverse colon, both kidneys, and both ureters. Periumbilical pain is the classic early presentation of appendicitis, before it migrates to the right inguinal region as inflammation reaches the parietal peritoneum. The left lumbar region contains the lower part of the left kidney, the descending colon, the jejunum, and the ileum.
The inferior tier of the 9-region grid, below the transtubercular plane, contains the most clinically recognizable regions because they house the structures responsible for the most common surgical emergency in the world, appendicitis. The right inguinal region, also called the right iliac region, contains the cecum, the appendix, the ascending colon, the small intestine, the right ovary, and the right fallopian tube. The appendix sits at the junction of the cecum and the ascending colon, typically at the McBurney's point, 1/3 of the way from the anterior superior iliac spine to the umbilicus. This is the classic point of maximal tenderness in appendicitis, a diagnosis that kills if missed. A critical clinical call-out, this sector is specifically named the inguinal region because it houses the anatomical inguinal canal, the passage through which the spermatic cord travels in males and the round ligament in females. Inguinal hernias, the most common type of hernia, occur precisely within this zone. The left inguinal region contains the small intestine, descending colon, sigmoid colon, left ovary, and left fallopian tube. Left inguinal pain in elderly patients is a classic presentation of sigmoid diverticulitis, often called left-sided appendicitis.
The central inferior region of the abdominal grid is the hypogastric region, also known as the suprapubic region or pelvic region. It occupies the central lower abdomen, bounded superiorly by the umbilical region, inferiorly by the pubic bone, and laterally on both sides by the inguinal regions. This region has a universal baseline inventory shared by all individuals, regardless of biological sex. The ileum, the sigmoid colon, the rectum, the ureters, and the urinary bladder when enlarged or filled. Beyond this shared baseline, the hypogastric region displays sexual dimorphism, different contents based on biological sex. In the female pelvic profile, the hypogastric region additionally contains both ovaries, both fallopian tubes, and the uterus when it is enlarged, as in pregnancy or fibroids. A full-term uterus extends well into the umbilical and even epigastric regions. In the male pelvic profile, the hypogastric region additionally contains the vas deferens, the seminal vesicles, and the prostate gland. The prostate sits immediately inferior to the bladder and surrounds the urethra, making this region the primary zone of benign prostatic hyperplasia and prostate cancer diagnosis in males.
We close with the most clinically useful slide in this entire video, the organ-to-region locator matrix. This synthesizes everything we have covered into a direct lookup table for 4 major abdominal organs. The liver spans 4 regions. Its right lobe occupies the right hypochondriac region, its body crosses the epigastric region, its left lobe extends into the left hypochondriac region, and the very tip of the right lobe reaches into the right lumbar region. The kidneys span 4 regions. Their upper halves sit in the epigastric, right and left hypochondriac regions. Their lower halves drop into the right and left lumbar regions, and their poles even reach the umbilical zone. The stomach spans 3 regions. Its main body is in the left hypochondriac, its pyloric part is in the epigastric, and its curvature extends into the umbilical region. The colon is the most geographically complex organ. The ascending colon runs through the right lumbar and right inguinal. The transverse colon crosses the left hypochondriac, epigastric, and umbilical. The descending colon runs through the left hypochondriac, left lumbar, and left inguinal. The critical takeaway: organs do not obey artificial bounding boxes. The 9-region grid exists precisely to capture these complex overlaps. Subscribe to Med Studious for more clinical atlases like this.